Hello and welcome to the class Health Education. Today we'll be speaking about health education, the approaches to health education and the principles of health education. A very brief class, but still it is an important class as this topic is always asked in the exams, in almost all university exams of India. In any university exam, any question regarding health education is definitely there in every exam. So let's start with what is health education. Health education, the definition of health education, it is a process aimed at encouraging people to want to be healthy, to know how to stay healthy, and to do what they can individually and collectively to maintain health and to seek help when needed. So there are three components here. One is we encourage people to be healthy first. Second is we want them to know how to stay healthy. Everybody wants to be healthy, but we want to make them sure, we make them know how to be healthy. And the third one is we we want them to do individually or collectively along with other people to maintain health and to seek help whenever it is needed. When they need help, they have to seek help. That is also a part of health education. So the definition is very simple, and even John M. Last, he has defined health education as the process by which individuals and groups of people learn to behave in a manner that is conducive to the promotion, maintenance, or restoration of health. Anyhow, that is not so important. The definition of health education, which has been told, if it is understood, it's enough. So, health education is a part of healthcare that is concerned with promoting healthy behaviors. So, now before it was just health education, now we have included health promotion in that. So, health promotion is a better concept than health education. So health education and behavior. So the behavior influencing strategies depend on specific disease concern. If there is no disease, no use of giving health education. We need to have some specific disease concern. People have to be educated regarding that disease and how to prevent that disease. So disease distribution in population. If the disease is there, how it is distributed, whether it is distributed in different strata, how much it is distributed in different areas, different strata, that has to be first understood before giving a health education and trying to change the behavior of the people. So and the third one, characteristics and acceptability of preventing and controlling methods. There are many methods which are not acceptable by the population, and those cannot be imposed on the population. That is why, so the third one, the characteristics and acceptability of preventing and controlling methods have to be taken into consideration if health education and behavioral change is desired. So health education, it helps to increase knowledge. So to increase knowledge, health education helps in increasing knowledge to reinforce the desired behavioral patterns. Already people will be having the desired patterns, the desired good behavior, like for example exercise, and some people would like to leave that exercise. For that we need to reinforce, keep telling them or keep making them aware that exercise is beneficial in the long run, so that behavior is reinforced. And now the changing concepts. Before it was just health education, now it is health promotion, as I said. So from prevention of disease to promotion of healthy lifestyle. Before it was just prevention of disease, how to prevent the disease. It is good for infectious diseases where it can be promoted, so prevented. Whereas for non-infectious disease, like for non-communicable disease, like hypertension and diabetes. It cannot be prevented, but it can be minimized, or the onset can be delayed by choosing to have a healthy lifestyle. So healthy lifestyle, so it means that when you ask them to choose a healthy lifestyle, it is like promoting the health. That is health promotion. Then the modification of individual behavior to modification of social environment in which the individual lives. The society, we modify the societal norms. So that is also a part of concept which has changed. Before it was just health education regarding prevention of disease. Now we ask the people to promote their healthy lifestyle along with changing of social environment. Then the third one, community participation and community involvement. This is very much important. Community also has to be involved. Only then any health education program is a success. Without involving community or without having a community participation, the program is never a success. So for that, community participation is very much required for imparting a proper health education. So the concept has changed. It was just a health education before, now it is promotion of health, changing of social environment or modification of social environment and community participation. These are the three things which have been changed or which have been brought up along with health education. The fourth is promotion of individuals and community self-reliance. Community need to be self-reliant. It should be reliant on itself rather than others. So the aims and objectives. The aims to encourage people to adopt and sustain health promoting lifestyle and practices. The aims of the objectives of health education. What we need to achieve, what we want to achieve from health education. We want to achieve from health education is to encourage people to adopt and sustain health promoting lifestyle. So we just can't just educate about prevention of disease. We need to educate them regarding promotion of health. How? By adopting healthy lifestyle. To promote the proper use of health services, the services which are already there, that how those things have to be utilized, that has to be imparted. So that's also an objective of health education. To arouse interest, provide new knowledge, improve skills and change attitudes in making rational decisions to solve their own problems. So we need to arouse them or provide new knowledge and give arouse in them interest to know about newer things which are happening in the society, so that they take proper decisions in prevention of disease. So that's the third objective. And the fourth objective is stimulate individual and community self-reliance and participation to achieve health. As I said, community participation is vital. So we stimulate the community to participate and become self-reliant. Now, approaches to health education. There are 4 approaches to health education. First is regulatory approach. Regulatory approach is defined as any governmental intervention, direct or indirect, designed to alter human behavior, to change human behavior. We take the help of the government, or the government gives law, makes a law to change the human behavior. And it was a failure because, for example, smoking, because passive smoking leads to different cancers in the people who are passive smokers. So that was the government passed a law that smoking in public is an offense, but still people smoke. So it means that it's not a accepted one. So next is service approach. Service approach, it aimed at providing all the health services needed by the people at their doorsteps, and irrespective of whether they need it or not, that service is provided to them at the doorstep. But again, it is a failure because we need to know what the needs of the people are. Without that, just giving the health services, it's of no use. We need to know what they need first, and then we need to give them the service. So that service approach is also a failure. Then the health education approach, again health education approach is a failure because health education in the adult stage for the adults will not give you any results, or the results will be minimal, because the attitudes and the behavioral changes generally occur when they are children. During the childhood they have the attitude and behavioral changes. So we need to address the problems during childhood. That is why health education during adulthood will be a failure. The fourth one is a primary health care approach, where we will the principles of primary health care like community participation, intersectoral coordination, all are incorporated into the approach. And then this is not a failure because we involve community, we take intersectoral coordination, we have an equitable distribution, we use appropriate technology. So for all these things we assess the felt needs, we assess the needs of the people, and then we give education regarding that which they require. We first assess what they require and then give the education regarding what they require. So these are the approaches of health education. The principles of health education, it's our credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relations, feedback, and leaders. So one by one we'll take credibility. It is a degree to which the message to be communicated is perceived as trustworthy by the receiver. Like if anybody who has a credible, who's credible or who's trustworthy, he gives information. Like for example, an information given by the WHO director, for example, is well taken. It is well taken because it's coming from a trustworthy person or a trustworthy fellow. Whereas information given by somebody who's already a smoker, he's already smoking and he's asking you not to smoke, people will not take it as trust. They don't trust the person who's a smoker because he's already a smoker and he's asking you people not to smoke. So credibility is very important. Second principle is interest. We need to arouse interest. We need to see whether the people are interested before imparting health education. If they are not interested and we give a lecture of more than 1 hour, it's all a waste. We should arouse in them interest. So how we arouse interest? Again, is a part of like whether we assess whether they require any information regarding the disease or not. Then we arouse interest in them, and then if they are interested, then health education is given. So the third one is participation. I said community participation is very important. Health education should aim at encouraging people to work actively with health workers and others in identifying their own health problems and also in developing solutions and plans to work them out. So we need to involve the community to identify what are the problems and how to solve them. So that is why the participation is very important. Then motivation. People are motivated. It is in every person there is a fundamental desire to learn. Awakening this desire is called motivation. Everybody wants to learn. So that we awaken the desire, that is called motivation. So there are two types of motivation: primary motivation and secondary motivation. Primary motivation is sex and hunger. These are the two primary motivation. Maslow's theory of hierarchy, it says the primary motivation is sex and hunger. A person will do anything for hunger and for sex. So that's a primary motivation, the driving force. And secondary motivation is the praise, the rivalry, the reward, the punishment. People are, if they do good things, they are rewarded. So it motivates them to do good things more. and people who do bad things, who are punished, it again motivates them not to do the bad things. So that is motivation. For the same thing in health education, we need to motivate them. Then comprehension. In health education, we just always communicate in the language people understand and never use words which are strange and new to people. Like we need to make them comprehend. Comprehend means understand. We need to make them understand. Any health education thing which makes people fail to understand is a waste. That exercise is a waste. If people fail to understand what you are trying to tell is a waste. So that's comprehension. Next is reinforcement. Reinforcement at intervals is very necessary. If there is reinforcement means repeatedly telling them. So there is every possibility of the individual going back to the pre-awareness stage. So people will forget or people will leave it. People get demotivated. People, if they are told something positive, that needs to be reinforced, that needs to be kept on telling. So that is called reinforcement. Next is learning by doing. Learning by doing. We need to do practical things. They say a Chinese proverb, if I hear, I forget. If I see, I remember. If I do, I know. So we need to make the community do practical exercises. Then only people will know what they are doing. Then health education will be successful. Then known to unknown. The next one is known to unknown. That is from a known person to unknown people. Like we must proceed from known to unknown. From when people know it, then we elicit what they know first, and from that we proceed to imparting knowledge about the unknown. So first we need to assess what is known, and then the known things have to be told. Next is setting an example. Setting an example. Health education should set a good example in the things he is teaching. Like I said, if he is a smoker, he cannot ask people not to smoke. First, he should leave smoking. He should not smoke in front of them. He should be away from smoking. Then he can tell about the hazards of smoking. If you call an alcoholic to give a lecture or give an health education regarding the hazards of alcohol, it will not have any impact. So that is setting an example. Feedback. Next is feedback. Good human relations. Good human relations. Without good human relations, if you do not have a good relation with the community, even giving the best of health education will yield no result. And feedback, it is the use of key concepts of the system approach. Health educator can modify the elements based on the feedback which he gets from his audience. Whatever feedback they give, based on that, the next health education program can be modified, it can be altered, or it can be improved upon after taking the feedback. Then having good leaders. Psychologists have shown that we learn best from the people whom we respect and regard. So leaders are agents of change, and they can be made use of in health education work. Catch hold of a leader, catch hold of a person who is responsible. We make them educate the people rather than a student educating the people. So this is regarding the principles of health education. Now what is health propaganda? Health propaganda, when persuasive communication is deliberately employed to manipulate feelings, attitudes and beliefs, it becomes propaganda. We enforce upon them. Instead of educating them, we enforce upon them the beliefs. So that is called propaganda. Knowledge is instilled in the minds of people. We are not providing education to them. It is directly instilled in the minds of people. It prevents or discourages thinking by ready-made slogans. Ready-made slogans, we don't involve the community. We just directly tell them about these are the things, these are the things which have to be followed, these are the things which are not to be followed. We do not involve the community. So health propaganda will not yield a good result. So arouses and stimulates primitive desires. So no use of giving health education. Instead, if you give health propaganda, they do not have they do not get educated properly. So health propaganda is just instilling. We directly put the idea into the minds of the people without involving them. So it develops a reflexive behavior, aims at impulsive action. Directly you tell them do it, don't do it. So it just provides impulsive actions. It appeals to emotion, and it develops a standard pattern of attitudes and behavior according to the mold used. So knowledge is spoon fed and passively received. We do not involve the community, we do not involve the principles of health education, we do not involve good leaders, we do not set an example, we do not ask them from known to unknown, we do not use credible persons, we do not arouse interest in them. We directly tell them things which are already known. We directly tell them things which are already known, and they just receive it passively. That's a health propaganda. And then the process is information centered, no change of attitude or behavior. We just tell the hazards of smoking, we will not ask them to leave smoking. That is promotion of health. Health promotion in health education is very much required. We need to ask them to change the behavior, we need to ask them to stop smoking. That is in health education. Whereas in health propaganda, we just tell them the hazards of smoking. It is left to them to change the behavior or not. That is not concerned. If it is not concerned, it becomes a health propaganda. Thank you.